population too, 217 people have severe or moderate visual impairment. That's for seeing far. Then 2015, it was estimated that 253 million people were visually impaired, and 1.1 billion have near vision impairment. That's the ones, mostly the ones that need glasses to see better, to read better, because some of them are not provided spectacles or they can't afford the spectacles. Then it said that despite all this, because of so many efforts that have been done globally, the prevalence of visual impairment has dropped from 4.58% in 1990 to 3.38% in 2015. And in addition, I want to inform you that new data is always presented on global blindness on the World Sight Day. So maybe by later today, we'll have information on what the statistics is for the prevalence of blindness and visual impairment by today. Maybe it could have dropped from 3.38 or it could have increased. But so many measures have been put in place, especially the trachoma control, the onchocerciasis control programs, which have been very, very effective. They've caused the reduce in blindness from these causes. Then 89% of visually impaired people live in low and middle income countries. That's like Nigeria, especially in Africa. That's why you have people that are mostly blind. So we need to do more. And then 55% of visually impaired people are women. Why is it said that women are the ones that are more than men that are visually impaired? Because most women don't have access to health care like they do in men. But looking at our patients, I see that most of them that are here are females. So that's a good thing, that females are coming out to take up eye care. So this is just like a picture to show what the global blindness and visual impairment data is as of 2015. You can see that 1.1 billion people with near vision impairment is because they do not have a pair of spectacles for reading. If this can be made available, I think the number will drop. And you can see that 89% of the visually impaired people live in low and middle income countries, which I highlighted. So this is just a summary of what I presented about the statistics. So what are the major causes of blindness? Well, cataract is still the cause of blindness, and it's said that 19 million are affected globally. Most in developing countries, that means in Nigeria and in Africa, because during the course of the presentation, I'll highlight why we still have a lot of cataracts to deal with. Then glaucoma is second with 66.4 million people affected. Trachoma, 5.7 million. But I think for trachoma now, maybe by the time the interventions that is going on, maybe it will have reduced. Then childhood blindness. Childhood blindness is also a cause of visual impairment. Children get blind, they get visual impairment. Some are born with it, some acquire it. But the thing about the ones in children, it can be treatable and avoidable. And then onchocerciasis, which is also known as river blindness, about 0.29 million, but that has also been on the decrease, especially in Nigeria, because of the intervention of treatment by NGOs, by the government. And then 10 million account for other causes of blindness, which such as diabetic retinopathy, age-related conditions. Then it's also said that unoperated cataract remains the leading cause of blindness, just as I said, in low and middle income countries. It's because most of our patients don't have access to where they can have surgeries. Even if they have access, the cost of surgery is expensive or the quality is not so good, so which can prevent some of these people taking up surgeries. Or the personnel are not available where they are supposed to be. Then the prevalence of infectious diseases such as trachoma and onchocerciasis, as I stated, has reduced significantly over the last 25 years. And this is due to the control programs. For trachoma, you have the SAFE strategy, whereby surgeries are done antibiotics are being distributed. Then environment, cleanliness is being emphasized so that you can control trachoma. Trachoma is linked with living in a dirty environment, dry weather, and where there's no water available. So, but now with improvement, the government at all levels, the local government, the federal government has tried to improve this in areas where trachoma is being affected, especially in the extreme northern part of Nigeria. That's why you find trachoma. And for onchocerciasis, which is river blindness, it's associated with people living by the rivers. And interventions were done in the past whereby such people were moved away, farmers were moved away from that area when they were found to be blind, and treatment has been given. So the number of patients we're seeing with onchocerciasis has reduced. In fact, earlier when I started my residency in National Eye Center, we used to give treatment for onchocerciasis. But now I think it's no more, because we're not getting the patients like we used to before. So we're still doing something. It's not that nothing is being done. And the sad thing is that over 80% of all visual impairment can be prevented or cured. It can be prevented, especially in children, whereby they have visual impairment, corneal disease, vision being affected, especially in measles. If they get their immunization done, it prevents all these complications. Or harmful eye practices, whereby people just treat themselves with traditional eye medications. Somebody has done it, I can do it. It also affects the eyes. So this is normal. It's usually done with children. You find that a child that just needs simple antibiotics is given a traditional eye medication, especially in the villages, because they don't have access to eye care or eye personnel. So this can be disheartening, because 80% can be prevented and can be cured, but we're not getting that. So just to just tell our guests what vision is, I don't want to go into the details of the technicalities of the visual acuities, but vision is either you have normal vision, moderate vision impairment, severe visual impairment, or blindness. For moderate visual impairment, normally what causes it is probably you need glasses and you don't have access to glasses. For severe visual impairment and blindness are normally from chronic eye diseases, or like cataract, glaucoma, or diabetic retinopathy. Then if you have moderate vision impairment and severe vision impairment, you fall into the low vision category. And if you have low vision and blindness, that means there's all vision impairment. So what are the causes of visual impairment? So according to the recent estimates, the leading cause of visual impairment is uncorrected refractive error. What that means is you need glasses to see far or to see near. So about 53% makes up of that. But you can see if people have access and are aware, this number will reduce. And it's just by giving simple glasses. There are glasses that are made that are cheaper, affordable. So we shouldn't be having people that have uncorrected refractive errors. And normally, this is normally in children. And then there's a program called the School Eye Health Screening, which is put in place, which should be put in place, so that these children can be detected early and be given the glasses early. And it's being said that, it's projected that by the year 2050, the number of our children that will be wearing glasses, that will not be seeing that will be short-sighted, that means they won't be seeing they won't see far very well, called short-sightedness, is going to our children are not doing outdoor activities. The way we used to do outdoor activities, most of our children are not doing it anymore. It's because of that phones, our tablets. Children are at the age of 2, they can use the iPad, they can use the tablet, they can pick your phone and do all games. So they're doing more of near work. We're not allowing them to go outside. Well, some for security reasons, some to prevent injuries. But most of us that did things have changed from when we were very young, majority of us here. We used to do outdoor games, we used to enjoy it, we used to go cycling, we used to do all sorts, but our children are always indoors. So much, too much homework, too much security. So it's being projected that by the year 2050, especially in the developed world where they are producing all these gadgets for children, you find that maybe by the time the child is 6 months old, he'll be able to operate an iPad. Not minding the consequences of what will happen, especially the radiation. Then another leading cause of visual impairment is unoperated cataract. I've told you the reasons. I'm going to highlight it further. Then age-related macular degeneration. In the countries where their people are aging, whereby their life expectancy is higher, they're getting these diseases that is due to aging. It accounts for 4%. Then glaucoma. Glaucoma is still another cause of visual impairment, which is irreversible. But if it's detected early, it can be treated and one can enjoy good vision. But most people are not aware, and it's because they are not being screened. They don't check their eyes. Then diabetic retinopathy is also going to will increase. Maybe in the next 5 years, this 1% will be 2% or more, because diabetes is on the increase, especially in Africa now. It wasn't a disease for the black man, but now it's a disease for black man. And it's because of our diets. So what are the major causes of blindness? It's still unoperated cataracts. You find out that you'll be surprised when we say we're going to do a free camp, that is free eye surgeries. We're always surprised that we see people coming with bilateral cataract. That means cataract in the two eyes, blind, dense. And most of them live around this area, and we're surprised. We're always telling them, don't you know about National Eye Center? Didn't you hear there's going to be a free camp? Or you've never been? Some of them don't have that awareness. And some of them is not because they don't have the awareness, it's because they don't have people to bring them. And some of them is the funds, they can't afford it. Then the uncorrected refractive error, because of lack of awareness and no glasses available, or the glasses available are too expensive. And then glaucoma. So who is at risk of blindness or visual impairment? Normally, if you're 50 and above, you're at the risk of blindness. You're at the risk of getting glaucoma. You're at the risk of getting cataract, age-related macular degeneration. So it's advisable once you reach that age, just like the way you do medical checkups, it's advisable you check your eyes as well. Then children below the age of 15 are also at risk of blindness. It's estimated that 19 million children globally have visual impairment. And of this, 12 million children have a vision impairment due to refractive error. You see the high number? It's because so many are there that need glasses, but they are not aware, or they've refused the glasses, or their parents have refused for them to take the glasses. Then around 1.4 million have irreversible blindness, and they require access to vision rehabilitation services for them to optimize their function and reduce disability. So a little bit about childhood blindness. What are the causes of childhood blindness? Just like you have visual impairment, the thing about the children is that it's avoidable and it is treatable. Like the avoidable causes, like vitamin A deficiency. If we're giving our children rich foods in vitamin A, they get their immunization. When they have measles and it affects the eyes, we take them to a health eye care personnel. Not that we treat them and put all sorts of, they say breast milk, urine. No, that is not good. Please, harmful practices. It worsens the eye condition. I've seen cases where just conjunctivitis and they put a traditional eye medication in the two eyes in an 11-month-old baby, because she didn't know with 50 naira chloramphenicol that eye could be treated, and that child is blind forever. A child that is 11 months, that child might live for 70 years, you don't know, and is blind for 70 years. Then corneal diseases. Like corneal diseases also falls into those with measles or or ophthalmia neonatorium, mothers. Some of you will know that some children are born, or the nurses that have purulent discharge, the eye is discharging, is ophthalmia neonatorium. If it's not treated early, that vision can be affected if the infection affects the cornea. Then some are hereditary, some are born with it, some you can't do anything, they are born with it. But some are due to maternal infections also. But that is for another day, maybe the gynecologist will treat that. But there are some maternal infections that if the mother gets it and she's pregnant, it can affect the eye of the child, especially rubella. Rubella is like something that is similar to measles, but it's more sinister if a mother gets it and she's pregnant. The child can be born either stillbirth, or it can affect the heart, it can affect the brain, it can affect the sight by giving them cataract or retinopathy. So that's the posterior segment pathology. Some are hereditary, that's nothing you can do. What you can do is to provide low vision for them to be able to function in the society. Then there is congenital glaucoma. Yes, the adults get glaucoma, children can also get glaucoma. Normally, sometimes, not in all cases that there's a family history, but sometimes when they come, we check the parents, because some of them are not aware they have glaucoma. Then retinoblastoma. Although retinoblastoma is a type of cancer and is life-threatening if they don't present early. If they present early, we can save the child, we can save the vision. But most of our people, they go round before they come, and by the time they come, the cancer has advanced. And then some eye problems are associated with some systemic diseases that we have to co-manage with other specialties. So this is like a picture of what vitamin A deficiency can do. Although we hardly see this now in our center in Nigeria, because most of our foods have been fortified with vitamin A. That's the sugar and the flour, so we don't get this. And we have a lot of fruits, we have a lot of vegetables, which we encourage our children to take. So we hardly see this. And vitamin A deficiency can cause night blindness as well. But we hardly see such cases now. It was in the past. So as I was telling you, the first picture, the one on the right, is a picture of a child with bilateral cataract. This child cannot see, and it's like maybe the child is about 4 years. He's ready for surgery in National Eye Center. And the other picture is a child with congenital glaucoma. The eyes are big, they are watery, and they are cloudy. You don't expect this child to see very well, but with early presentation and treatment, this child can be made to see. If it is not very normal vision, we can get that child to see at least low vision that he can function in the society. So I've talked about what is the estimates of blindness and visual impairment globally, that means in the world. What of Nigeria? Well, in 2005, there was a Nigerian blindness survey. That means the estimate for blindness and visual impairment was conducted in Nigeria to know the number of people that are blind, to know the number of what causes blindness in Nigeria, the majority causes, and what can be done, and where they are living. So a survey was conducted, and a team of ophthalmologists, majority of them from National Eye Center, were involved in that project, with optometrists, ophthalmic nurses, and they went around to 36 states. They didn't cover every household, it's not possible, but houses were enumerated by sampling, and clusters were identified, and they went to all these households to examine. Majority of the ones examined were 40 years and above, because most of the causes of visual impairment is more from 40 years and above. But in households where they had a few children that were believed to have some form of blindness, they were examined. But the survey project was mainly for adults, to know the number of people that are blind.